Welcome, everyone. Thank you for joining me today for keeping ourselves safe during cold and flu season. We got a lot to cover today. We're really going to talk about your basic respiratory cold, flu, RSV, COVID-19, and how they're spread. We'll talk a little bit about pneumonia and shingles, and basically how to keep yourself healthy. A lot of this for you already is common sense, but it's like, anything else in our life, we kind of put it to sleep for the summer. We don't think about it. And then all of a sudden, cold and flu season is upon us. And whoops, we're caught with our, our pants down. And all of a sudden, we've got a raging cold. And everyone around us has the flu. So again, we'll just talk about that. Before I begin, I want to just let you know that these are facts that were taken by the CDC, the HHS, and other medical, very astute Mayo Clinic, Cleveland Clinic. This is not my opinion. I don't suggest one way or the other that you do or don't do the things that we talk about. These are really mere suggestions. And if you feel like for any of these, you need to see your doctor, this is not medical advice. It is always important to seek medical help from a good healthcare provider that can lead you in the right way. So these are the things that we're going to cover today. And we'll start out with the most common, the common cold. That's a rhinovirus. And that's really, actually, I shouldn't say it's just the rhinovirus. There are many viruses, probably more than 200 viruses that can cause a common cold. About 20 to 30% are of unknown bugs. And the most common of the common cold virus is the rhinovirus. How do you get a cold? It enters the body through your mouth, your eyes, or your nose. And they can be spread by sharing objects with the virus on them, such as dishes and towels, toys and telephones, touching your eyes, nose, or mouth after contact with the virus. So it's not only important for you to practice good hand washing and disinfecting, it's important for other people to do it too. And always assume that the person around you does not wash their hands like they're supposed to, which means you should always wash your hands like you're supposed to. Now, as we go into this, I do want to tell you that there's a couple of things on here, pictures, tables, that distinguish what a common cold is different from the flu. If you have a cell phone and you want to get your camera out on your cell phone, it would be nice if you took pictures of those so you had them as reference. If you don't have that, all of this is found on the internet. I just did the homework for you. Okay, so common cold risk factors. First of all, it's age. So we look at the elderly, of course, but infants and young persons also have a greater risk of colds than other people, especially if that child spends time in childcare settings. So some of you do babysit for your grandchildren, and if they're in school or if they're in childcare settings and they're not practicing good hand washing, it's important that you make sure when you're babysitting. For my grandkids, the first thing they do, and they still do it, the youngest is 7, so we're out of daycare and I'm not babysitting as much, is the first thing my grandkids do when they come in our house is wash their hands. And that's a good practice for them to get into, because as they start venturing out in the world, they will know that that's important and they should wash their hand whenever they change a location like that. People with weakened immune systems. So someone having a long-term illness, cancer, chronic diseases, or just something that's weakening your immune system, an autoimmune disease, puts you at risk for getting the common cold. We know that the time of year is important. It's mostly in the fall. So now is a good time to think about your behaviors and how your prevention behaviors and how you would prevent the common cold. But we also get those summer colds, and those are pretty nasty too. So we never really want to fall off with our preventative measures in the summertime either. People who smoke, unfortunately, or people who are around secondhand smoke, that increases their risk factors of catching a cold. And then, of course, exposures to crowds, such as at school or on an airplane, that's going to increase your chances of getting a cold. So we usually travel in the fall, and I wear a mask when I'm on the plane. Until I know that there's not people around me coughing and sneezing all over me, and I'm nowhere near, I'm keeping that mask on. And I really don't care what other people think of me anymore. I'm older, so I don't care, right? So I will keep that mask off until I get out of that crowded airplane. All right, some of our symptoms. The most often common cold symptoms usually start in about 1 to 3 days after someone is exposed to the cold virus. And those symptoms, like I said, are going to vary from person to person, but they will include possibly a runny or a stuffy nose, a sore or a scratchy throat, a cough, sneezing, generally an unwell feeling with mild body aches and a mild headache, and you may run a low-grade fever. The mucus from your nose may start out as clear and become thicker and yellower or green. That change is normal. Most often it doesn't mean that you have a bacterial illness, but if you're still feeling unwell, you do need to see the doctor, and they will check to see if you have something else going on besides the cold. And a cold usually lasts about 5 days. And again, it's going to vary from person to person. Because we are older in age, and people who are younger who have a compromised immune system, we have complications of the common cold, and those are middle ear infections and asthma. A cold can trigger wheezing, even in people who don't have asthma. So, but people with asthma, it can make it worse. Real commonly is sinusitis, and that leads to swelling and pain in the sinuses. Sometimes it's viral, sometimes it's bacterial that'll cause the sinusitis. The doctor may, depending on what he sees, is that he may put you on an antibiotic for that. A lot of people say, oh, the doctor didn't put me on an antibiotic. I don't know why I need one. You don't need an antibiotic for a virus. You need an antibiotic for bacteria. Antibiotic for a virus is not going to do anything. An antibiotic for bacteria will take care of that. So, but either one can cause sinusitis, bronchitis, and pneumonia. Those are some of the complications. And again, people who are compromised, my mom had COPD, and so she was at risk. And every time she got a cold, she would get bronchitis. And if she didn't take care of it right away, it would lead to pneumonia. So, you know, there are things that can happen just from a common cold if you don't take care of it. So are you silly for visiting the doctor for a common cold? No, not if it doesn't go away. If you're having all the signs of a common cold and you're doing things to make yourself feel better and get yourself well, which is drinking plenty of fluids, resting, making sure you're well hydrated, and after 5 to 7 days, you are feeling worse than you did, then you need to see the doctor. Then there could be an underlying complication to that. So how do we prevent a cold? Wash your hands, wash your hands, wash your hands. It's really important. And I can't say that enough. Not just under, go into a public bathroom. It's very interesting. You wouldn't want to go in there again or follow these people around afterwards. But you go into a bathroom and you listen to people either walk out without washing their hands or washing their hands, and it's a 2-second, spritz under the sink. A good hand washing is 2 minutes. Singing happy birthday to yourself. If you're religious, saying the Lord's Prayer to yourself. That is the length. And I say that because I used to work at a Catholic community, but singing happy birthday, doing the ABCs, those are all ways that you're washing your hands for 2 minutes. There's things that are important in hand washing. It's time and friction. Rubbing your hands together for 2 minutes with soap and water is what is going to get that bacteria and viruses off of your hands. Don't share food, drinking cups, plates, or utensils with anybody if you have a cold. And if you're around someone else that has a cold, then I wouldn't share their utensils with you. But you really want to stay away from people with colds. I know we all want to be social, and in the Midwest, winter can be kind of a drag. We don't get out as much, although the summer hasn't been fun to get out because it's been so darn hot. But we tend to stay in more during the winter. And so when we're invited someplace, we certainly want to go, but we don't want to end up sick after it. So again, just making those good decisions will help. And wear a mask if you need to, making sure that you're not spreading those germs. Covering your cough or your sneeze, you want to do that not with your hand, because again, particularly if you're not a good hand washer, you're not going to cover it well enough. Oh, I'm sorry, you're going to cover it with your hand, but you're getting the bacteria, the virus on your hands. You're going to cough or sneeze into your elbow or your forearm. Okay, so again, making sure that you're coughing or sneezing the right way is helpful. So again, when to seek medical advice. If the symptoms get worse and don't get better, you have a fever greater than 101.3 degrees Fahrenheit that lasts more than 3 days. Fever returning after a fever-free period. So you had a fever, it broke, and now it's starting again. If you have shortness of breath and wheezing, an intense sore throat, headache, or sinus pain. I'm going to go back to the fever 101.3. I would say for older adults, if you have a low-grade fever, it's probably because our thermometers as we get older, our internal thermometers aren't as regulated as they are when we're younger. I would say if you're running a low-grade temp, 100 degrees, I would call the doctor. I would not be afraid to call the doctor if you have a 99.9 temp degree and you're feeling pretty lousy. You need to seek medical advice. That's what your doctor is for. All right, moving on. Let's talk about influenza. And I think this is going to be the big guess this year. And I'll tell you why. Typically around springtime, the forces that be around the world, people who are in virology and looking at influenza, come together and they decide what type of shot is going to be out there. And they base it on what they saw last year, what's starting to float around maybe in China, what they're, and in the other countries, what they're starting to see. And that's what they base the influenza shot on. And United States has always been represented. However, this year they declined. RFK decided that we didn't need to be at that. So what I'm going to say is it's a big question mark right now as to, I can't tell you what viruses are going to be out there because we weren't at the table. If you want to, you can look to other countries to see what it looks like for them. And because we're looking at kind of a pushback on influenza vaccines by our government, I'm not sure what the supply will be. I'm hoping that there's enough influence from other countries that our supplier of these influenza vaccines that participated in these, ongoing discussions will be able to share that information with us, and we will be able to get the supply and demand that we need. And I know that sounds vague, and I apologize, but that's really where we're at right now. I'm not saying that to scare you. What I'm saying is I think I would look at getting a influenza vaccine earlier than later. I know a lot of people wait until November or late October to get their flu shots. And what I'm saying is I would look at getting them earlier, so the supply chain is there. We know that flu is a very contagious illness. It's caused by an influenza virus. And that infects the nose, the throat, and sometimes the lungs. It can cause mild to severe illnesses, and at times it can lead to death. Typically, our flu season occurs late fall and early spring. So it usually goes till about March. Sometimes, about 10, 12 years ago, it really lasted until May, believe it or not. But typically it's over around March. The flu activity peaks in January and February. The symptoms come on suddenly, and it includes fever, coughs, sore throat, runny nose, stuffy nose, body aches, headaches, chills, and fatigue. Okay. Now, what about getting your flu shot early? You're getting dosed early, which is a good thing, because you will be covered for that, that early fall. And you may want to get a second dose in early winter, like January. The pharmacists may suggest another dose. Your pharmacists are up to date on all the influenza vaccines, what their side effects are, how long they last. And I always will talk to my pharmacist about flu, COVID-19, RSV. They are the people who know the most about this. So don't be shy. You don't want to go to a pharmacy tech, because they don't have the inclusive knowledge of all of the vaccines like the registered pharmacists do. They're doctors in pharmacy. So be comfortable asking them those questions. So again, I would start doing my research early, talking to your pharmacist maybe this week. What do we know about the influenza vaccines? Are we going to have a supply that's enough? Is it too early to get mine? I usually get mine late August because I travel in September, and I want to be dosed and covered, because it takes 2 weeks for you to have that to become effective. So I usually get it in August. So when I fly and I'm on vacation, I'm fully covered. So this is how infected droplets, how influenza is spread. I will tell you, this is something that happened to me about 7 years ago, and it is so clear today. I was in line in the pharmacy to pick up a medication, nothing related to flu, absolutely nothing. The guy in front of me sneezed twice and did not cover his sneeze, and he coughed. He was right in front of me. He was right in front of me. They called him up, and he said, I need my medicine for my flu. My antiviral. I just rolled my eyes. I thought, oh man, 24 hours later, like clockwork, I was sick with the flu. I got this flu. He sneezed right into my personal space. He coughed right in, because those air droplets travel. They can travel several feet. And so they traveled right back into my nose and me breathing. And I ended up with a really nasty flu that year. And if I could find this guy, I would tell him how sick I was. So be careful of the people that surround you. And again, this is how people get the flu. Make sure that you're washing your hands, that you're keeping your distance from people when you're talking to them. Now, if you have a camera and you want to take a picture of this, this is a good one to take a picture of, and I can always go back at the end too. But these are some of the flu symptoms: runny nose, cough, headache, fever, diarrhea. For some people, older adults tend to get a little bit of diarrhea with the flu. Not everybody. Some people get vomiting. Again, not everybody. Most everybody gets joint and muscle aches, sore throat, and they get fatigue. And they will have a fever with this. So again, and this is your steps for washing your hands. So if you want a reminder, you can put this, copy this, take a picture of this and put it on your refrigerator, and wash your hands, wash your hands, wash your hands. Get a flu shot, wash your hands, stay away from others who are coughing and sneezing, wash your hands. Wear a mask, wash your hands. Cover your cough and sneeze with your inner arm, not like that guy did in front of me where he just sneezed all over everybody. So here's some myth and facts. You can catch the flu from the vaccine. Absolutely not. It's what they call attenuated virus, which means it's dead. So you can't get the flu from the flu shot. People will say, well, I got the flu 3 days after I got a flu shot. It takes 2 weeks, about 2 weeks, for your body to build the antibodies to that virus. So if you get a flu shot and 3 days later, you're out in a crowd and someone has the flu and you're in close proximity to them, chances are, and you're not a good hand washer and you don't, you don't keep your distance, chances are you're going to get the flu because your body has not built those antibodies. Healthy people don't need to be vaccinated. That is not true. Everybody needs to be vaccinated, but there are some people that choose not to be vaccinated. Getting the flu vaccine is all you need to protect yourself from the flu. No, there are things that you do. You stay away from people that have the flu. During the cold and flu season, you still stay well hydrated. You eat good meals, keep your protein up, and make sure that you're eating well, and just staying away from people who have the flu. The flu is just a bad cold. No, it's a different type of virus. And you can't spread the flu if you're feeling well. You can still, that flu bug is still activated in you. First of all, when you first get the flu, you can spread it, and you can spread it even after your symptoms have gone away. You don't need to get a flu shot every year. Yes, you do, because your body, first of all, your body starts breaking down that immunity to that virus. But the other important thing is, like I said, the powers that be meet every spring and they talk about what viruses are out there. If you have a fever, high fever with the flu that lasts more than a day or two, antibiotics might be necessary. May or may not. That's why you need to see your doctor. Sometimes, because the flu can go into complications like pneumonia and bronchitis and sinusitis, that you do need to see a doctor. They will check you out. They will see, they may culture you to see if you have another type of infection, but they will go ahead and take care of that, whether you need it or not. So the other thing I wanted to say about the flu is, if you have the flu, there are antivirals that you can take, and that's your choice. I took an antiviral once for COVID-19, and the antiviral actually made me not feel good. So I said I'd rather cope with the symptoms of the COVID that I have, because it was on the milder side. So if the doctor offers a antiviral, it can shorten the length of that virus and get you better sooner. But for some people, they don't like that feeling either. So again, it's a personal preference. Sometimes if you have a severe chronic disease, it might be a good idea to do that. But again, that is a discussion with your healthcare practitioner, your doctor. So here's another image that you may want to take a picture of. It's got a picture of what you have for a cold and what you have influenza, and what they look like together. You're going to have both are caused by a virus. Or both of them, you're going to have a stuffy nose, cough, and a sore throat, and they're both respiratory infections. However, for a cold, the onset is gradual. On influenza, the onset is sudden. I have to share something with you, and everybody, some people may feel this way, and maybe that's where they got that slogan, starve a cold, feed a fever, or if maybe I'm saying that wrong, but my first symptom, and this has always been with me, when I'm getting a cold, I get very hungry. I can't satiate myself for about 24 hours. And then all of a sudden I start getting the symptoms of the cold. So when my appetite increases and it's cold and flu season, that's one of the first things that I either think about, or if I'm not paying attention, the day that I get the cold, I go, oh, that's why I was eating myself out of house and home. So some people have an itchiness at the top of their roof of their mouth. Everybody might have some of those, when the onset is starting, you might have some funky feelings in your body. Maybe it's just the achiness that you might feel. So again, a little bit different on both of these. All right, so we'll go into coronavirus, and it is COVID-19 or coronavirus, and that's was caused by SARS. And the World Health Organization first learned of this new virus on December 31st, 2019. And that followed a report of cluster of cases of so-called viral pneumonia in China. Most people can make a full recovery without needing hospital treatment, but people with high risk people, such as people with COPD, congestive heart failure, cancer, autoimmune diseases, older adults, we will need hospitalization, and sometimes their symptoms are enough to cause death. So over 760 million cases, and 6.9 million deaths were recorded since November 2019. They actually think the number was higher because there were a lot of people who didn't, they were afraid to report. So over 13 billion vaccine doses have been administered as of June 2023. So there's hundreds of different coronavirus that are related, and I know they're looking at a new one right now. I'm not sure what that is. Most coronaviruses only affect animals, and there's only a few coronaviruses that can affect people. And some of them just cause common cold symptoms, while we know that there are ones that cause serious illnesses. And that's why for this coronavirus, it was different from the common cold one. And we saw people, in other countries getting sick and sicker and sicker. And that's why there was that public reaction to it. Besides COVID-19, there's other serious coronavirus infections such as SARS, SARS, and MERS, MERS, but hardly anyone gets those anymore. And we know that with COVID-19, it affects mostly your lungs and airways. They're starting to learn more and more about long haul COVID, people who've had symptoms for since they got COVID, which is really too bad. So how is it spread? It's spread when infected persons breathe out droplets and very small particles that contain a virus. Other people can breathe in those droplet particles, or these droplets and particles can land on their eyes, their nose, or their mouth. And in some cases, these droplets can contaminate even the surfaces that other people touch. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. That's why everyone was required to wear a mask. Mostly it's in the air that you are spreading it. by singing, by talking, and by sneezing. Remember that choir group that they moved apart? They decided they were still going to have their choir group singing, but they moved so many feet apart, and they took their masks off to sing. And quite a few of them got very, very ill. And I think several of them died from contaminating each other's. So again, it can be through touching things that an infected person has touched. So this is really where contamination on surfaces you need to pay really good attention to. So again, here's another little graph of symptoms of COVID-19. And we're looking at muscle aches, sore eyes. My daughter had COVID-19, and she said for her, and everybody says something different about COVID-19, but for her, it was the eye pain. So there is sore eyes for some people, dizziness. Some people might feel tightness in their chest. I've heard people say that that was the most concerning for them. Shortness of breath, hoarse voice, heavy arms and legs, they just couldn't get off the couch or out of bed. Nausea, vomiting, abdominal pain, belly aches and diarrhea, loss of appetite. And so we know that some of these symptoms can get pretty severe, that you would need to seek medical attention. And that's difficulty breathing, especially at rest, or unable to speak in sentences, and have to take deep breaths, or you're becoming confused, drowsiness or loss of consciousness, persistent pain or pressure in the chest, and your skin being cold or clammy, turning pale or bluish color, loss of speech or movement. Those are pretty significant late signs, and hopefully by this time you're in the hospital and you're seeking medical care. Don't goof around with COVID-19. I know that we've been through a couple more winters with it, and yes, we've weathered that a little bit better than we did when we didn't know anything about it, and we were doing the best we could, but it still is no joke. People can still die from COVID-19 because it can dehydrate someone very quickly. It can get into the lungs very quickly, and that virus is just notorious for getting in and infecting someone. Our population at risk is our older adults, so us, people with high blood pressure, diabetes, cardiac and lung disease, kidney disease, other chronic diseases, cancers. Our minority groups, and why our minority groups and those with disabilities, they may not be privy to the health care that we get when we're insured. We will see a change in that probably this year with the change in the Medicaid disbursement. So we will see people with disabilities don't have the advantage of getting out and getting immunized or getting to see their doctors. Same with my minority groups, a lower socioeconomic standing. So how do we prevent this? We really need to get vaccinated. It's important. Again, trust your pharmacist, listen to what they say, talk to your doctor, listen to what they say, and make a good, educated decision for yourself. Keep physical distance of at least 3 feet from others, even if they don't appear to be sick. Avoid crowds and close contact. This is the time of year when an elevator opens and there's 4 people on the elevator already that you say, I think I'll wait for another one. Because you want to keep that distance. Make sure that you're wearing a properly fitted mask when physically distancing is not possible, or you're in a poorly ventilated setting. Wash your hands frequently with an alcohol-based hand rub or soap and water. So we do know that cleaning with an alcohol-based rub will help. So for the ladies, you've got those little things you can attach to the your purses, and for the gentlemen, they're small enough you can put those in your pocket. You know, Kristen had mentioned our fair tomorrow, our senior fair. We've got a lot of vendors there. I'm not saying that I know for sure anybody will have hand sanitizer, but usually at a fair like this, someone does. So if you're walking past the tables, take advantage of that. And if they have a hand sanitizer, be able to grab one and throw that in your purse. Cover your mouth and nose with a bent elbow, like we talked about before, or a tissue when you cough or sneeze. Again, if you're doing it, you know, either way, because some of those travel, and especially if you're coughing into a tissue, you're handling that tissue. When you're done, make sure, even though you use those two techniques, you're washing your hands with the alcohol-based hand rub. And that's for anything cold and flu. If you develop symptoms or you test positive for COVID-19, self-isolate until you recover. Talk to your doctor about what that isolation time is, because that's changing all the time. So I don't want to tell you how long you should self-isolate. You should listen to your doctor on that. As far as testing, I don't know. I would assume not. But again, talk to your pharmacist about this, because they will know for sure whether we are getting free tests this year. I'm not sure about that. So you may want to talk to your pharmacist or your doctor. Your pharmacist probably will know more than your doctor about whether you can apply for a free test kit. If not, they will have them at the pharmacy. So you should get a COVID immunization if you've never received a COVID-19. If you've received one last year, you should get one this year. Again, they're looking at what's out there, you know, because every year it replicates just a little bit different. If you're age 65 and older, if you're high risk for COVID-19, if you know someone living in a long care community, if you're pregnant, breastfeeding, trying to get pregnant, or might become pregnant in the future and want to lower your risk of getting long haul, and that actually should be underneath the pregnant information. You really should, for anybody, not just pregnant breastfeeding women, which doesn't apply to our group here, but want to lower your risk of getting long COVID. So how does the immunization last? Well, again, that depends. There's different manufacturers. And again, talk to your pharmacist about which one they are supplying. Sometimes they supply both. They may supply Pfizer and another one. Sometimes they just supply one. It's the genetics, your genetics, and the genetics that they put in it, what they're doing this year. How your immune system is, and your age. The older you are, the less it's going to keep, but the average is about 3 to 6 months. All right, moving on to pneumonia. That's a lung infection that can be caused by a bacteria, a virus, or a parasite. So you'll hear people saying, I have bacterial pneumonia, I have viral pneumonia, I have parasitical pneumonia. Those are 3 different types of pneumonia. Symptoms are pretty much the same. Some are a little more virulent than others, but they are caused by different things. Now, if you have bacterial pneumonia and the doctor decides that you have bacterial pneumonia, and it depends on how you're presenting and what they're hearing in your lungs, and they may even take a culture of your sputum, they may put you on an antibiotic. If they think it might be viral, but they're not sure, they'll put you on an antibiotic just prophylactically, just in case it's bacterial. And a parasite is a completely different thing. So what we know about it is it can affect both lungs. Older people can get pneumonia from hospitals and extended stays at medical facilities. We look at the environment that's full of germs and strains of pneumonia that may be more difficult to treat with antibiotics. Usually when elderly people go to the hospital, the organism that causes that pneumonia is strep pneumonia or myoplastic pneumonia. Strep pneumonia usually happens after you have a cold or flu. Myoplastic pneumonia is what we call walking pneumonia, and it's really just a milder strain of pneumonia that doesn't usually require bed rest. You don't hear of it very often. But keep in mind, it also can be caused by a fungi or a parasite. And this is the type of pneumonia that older people should be particularly careful of. It primarily affects people with chronic health issues, and it comes from inhaling certain kinds of fungi in the soil or bird droppings. So you should be, if you're gardening in the fall, you should be wearing, and even now, you should be wearing a mask. So, and if you're digging up the dirt, you need to wear a mask and make sure you're washing your hands. Other people that should be aware that viruses such as COVID-19 can also cause pneumonia. So, like I said, can cold and flu. So in most cases, viral pneumonia is milder, but it becomes serious. And it can become serious because an antibiotic's not going to help it. So we do know that if it goes untreated, pneumonia can have serious and lasting effects in older adults. So signs of pneumonia in older adults: fever and cough. It's the signs of pneumonia, fever and cough, might be less severe in older adults. You might see more confusion in older adults, but they may have diarrhea and dehydration from that, shortness of breath. They may have a racing heart from it. Any signs of pneumonia as an older adult, you should seek medical advice. There's treatment centers. You don't have to go to the emergency room unless you really think that you're so compromised that you may be admitted. But if you went to a treatment center and they felt you needed to be hospitalized, they're going to call an ambulance for you anyways. My doctor has, and I know some doctors have this, my doctor's group has every morning from 7 until 9, there's a walk-in clinic, and you can walk in and say, I think I have a cold, I think I have a flu, I think I stubbed my toe and I broke it. You can see the doctor for anything, and those are usually short visits, and they will draw the labs if they need it. They may send you for an x-ray, but you can be seen right away. Now, not every doctor has that service. So there are the treatment centers that you can go to that are open, but they're not open 24 hours. And just know that your emergency room is open 24 hours. So prevention: stay hydrated, stay away from sick people, and wear a mask. Get a flu shot. The Pneumovax is a 2-step vaccine for older adults that will help prevent pneumonia in older adults. And it looks like there's a slide fix here, so sorry about that. So Pneumovax is a 2-step vaccine. You get one, and then you wait several months, and you get the next one. But that's important. Getting a flu shot's important because it may prevent that pneumonia, and we just really want to make sure you don't get that. Pneumonia treatment for older adults is if antibiotics are used, it's very important to know whether the pneumonia developed at home, in a retirement or a nursing home, or in the hospital. So they're probably going to ask you where you've been, not because they're trying to be nosy, but they want to get an idea of maybe what kind of an antibiotic to put you on. And another factor that's considered when selecting medication is whether you're not you've had to take antibiotics in the last 3 months. If you have, an antibiotic that might be effective against what we call multi-resistant bacteria will be used. Otherwise, hydration, rest, stay away from others. Age is very important in the treatment in pneumonia. So again, you need to seek help if you feel like you have any of those symptoms. All right, we're almost done. We're going to talk about RSV, and that is a common respiratory virus that infects the nose, the throats, and lungs. And we never saw it very often in older adults, but we're starting now in the last 10 years, we started seeing more and more of it in older adults. So again, it's viral. It spreads in fall and winter, and it usually peaks in January and February. It's very difficult to distinguish this from other respiratory viruses because the symptoms are very, very similar. So the people who are at risk for RSV is someone who's 75 years and older. They have chronic heart and lung disease. They have weakened immune systems. They have other underlying medical conditions, and they are living in nursing homes. So those are all the people that are at risk. So that might mean people out in our community are at risk for RSV. RSV can also cause more severe illnesses such as bronchiolitis, which is inflammation of the small airways of the lung, and pneumonia. And its most common cause of bronchiolitis and pneumonia in children younger than 1. We lose children to RSV, and we can lose adults to that as well. So again, sometimes it gets severe enough that a person needs mechanical ventilation. So again, you can see these symptoms are pretty much the same. That's why you need to see your physician so he can kind of figure out what virus you may have. And you may have a cough and a runny nose, a fever, and a sore throat. You might actually graduate to wheezing, rapid or difficulty breathing, and bluish skin, which is a sign of low oxygen. And those are indicators of severe RSV. You know, many of us went out during COVID and bought a pulse oximeter. They sell them on Amazon. They're easy to use. You just put it on your finger, excuse me, and it tells you what your pulse rate is and what your O2 rate is in your body, what your O2 level is. And so, you know, it's not a bad thing to have at home, kind of with your little blood pressure machine that you use. So when you're calling the doctor or you start to see these symptoms, you can put that on your finger and get a reading. So we look at when to seek medical advice. And I pretty much talked about that. Difficulty breathing, you're having trouble eating or drinking, chest pain or pressure in your chest, sudden dizziness, confusion, and worsening symptoms. And there is an immunization for RSV, and the CDC recommends everyone ages 75 and older get an RSV vaccine. They also recommend adult ages 50 to 74 who are at risk of severe RSV get a RSV vaccine. So if you're compro immunized, if you have high blood pressure, if you have COPD, CHF, heart disease, if you're around small children all the time, it's a good idea to do this. It's not currently an annual vaccine, but if you've already received an RSV vaccine last year, you should not get another RSV at this time. But again, talk to your pharmacist about this. It depends on what month you got that in, that you want to schedule one about a year later, I believe. So again, talk to your doctor about the pharmacist and doctor. You can get one at a time, but the best time to get vaccinated is, or I'm sorry, you can get one at any time, but the best time to get vaccinated is in late summer and early fall. Our last one is shingles, also known as herpes zoster. That's a viral infection, and it causes very, very painful rashes. If anybody's out there had herpes shingles, then you know what I'm talking about. It can occur anywhere in your body, but it typically looks like a single stripe of blisters that wraps around the left or the right side of your torso. But it can really, it really follows a nerve path is what it does. So that's why it looks like it's in a singular line. You can get it on the face, you can get it on your arms, you can get it on your belly, you can get it in your genital, anywhere that there is a nerve path, you can find shingles. It isn't life-threatening, but I will tell you, it can be extremely painful. It's caused by the same virus that caused chickenpox. And so what happens is, after you have chickenpox, which is varicella zoster, it lays dormant in your body for years. And once your immune system is compromised, then it can present itself as shingles or herpes zoster virus, and it can be very, very painful. Vaccines will help lower the risk of shingles. Early treatment when you have shingles may shorten shingles infection again. An antiviral will help that. It'll help lessen the complications of it. The most common complication is post-therapeutic neuralgia, which is an underlying nerve pain that you have for a very long time. It's a painful condition that causes shingles pain to last for a long time, even after your blisters are cleared. Here's what it looks like. Excuse me, again, you can see that it usually runs in a single line, but it can look like clusters like this. This is on her shoulder, which is a common place. This is on an arm. It'll start out as a rash. You may start feeling tingling or burning sensation to touch and burning. And it typically, like I said, runs along a nerve path. The rash turns to a fluid-filled sac and then scabs over and typically affects one side of the body. Cold sores are called herpes simplex. Now, I will tell you, I get cold sores because I had the chickenpox virus when I was a kid. And so I am prone to cold sores or herpes simplex. Again, usually when if I'm stressed out or I'm immunocompromised, I will get it. I can tell it's starting to happen because I get a little tingling by my lip. And if I can get the antiviral, which is just a little cream, and I can start putting that on my cold sore right away, as soon as I feel that tingling, it shortens it by days, and it may not even erupt at all. However, if I ignore that tingling and I go a whole day where my lip feels funky, and the other thing I feel is fatigued. If I feel this fatigue and I let it go and I get that cold sore, I can still put the antiviral on it, but it's not going to work as much as it does when you get it on at that first sign. So when you have a cold sore and you buy the antiviral, you want to make sure that you're getting it on right away. And you'll find that in the cold sore section of your pharmacy. So some people will experience pain when they have shingles, sensitivity to touch and tingling, like I said, prior to the rash, and it'll continue after the rash appears. You may get flu-like symptoms. Again, even just a cold sore, I get kind of achy, fever, headache, and sensitivity to light for some people. People gradually the pain becomes gradually more intense. And then the rash actually will turn to a fluid-filled sac that becomes itchy. And that's the hard part. Remember when you were a kid and you had chickenpox, how much you wanted to scratch yourself because those fluid-filled sacs are very itchy. You don't want to scratch those at all. The scabbing then occurs in about 7 to 10 days. Shingles is contagious until the lesions are completely crusted over. So you don't want to touch them and then touch other things because, again, someone else can get it. If I touch my cold sore with my hand, I can't give myself shingles because I have that in my body. But if I touched my cold sore and with my hand and I touch someone else, I could possibly infect them. There's something that's called the neuropathic pain that I talked about, and that can continue for months and months, and for some people, sometimes years. In my practice, I worked in, as a new nurse, I worked in a clinic at Loyola, an eye clinic, and we had a young gentleman come in who had shingles on his face, and they had gone into his eye on his cornea. And we gave him 100 of Demerol, that's a pretty heavy narcotic that we're giving someone. We gave it to him IM, so he got a shot of 100 of Demerol. It didn't even touch the pain because your cornea is very sensitive to begin with. And obviously, and I don't know the outcome, whether it damaged his cornea for good, but it can. So getting it on the face can be very detrimental to your vision. So prevention of shingles, if you've had chickenpox at a younger age, you're really encouraged to get the shingle shot, the Shingrix. And there's two types. 2017 is, again, talk to your pharmacist, but that is typically the recommended medication. That's the immunization that you want to get. And again, it's done in 2 doses. So our takeaways from today, a lot to think about, and it's really just staying healthy. And you probably do a lot of this anyways, because we've lived a long time and we've lived with all these viruses and these bacteria. So we know how to take care of ourselves. But again, it's just good practice to keep that in the forefront of our brains. So we can avoid any colds and viruses and bacteria by practicing good hygiene, eating a well-balanced diet and staying well hydrated. You know, you want to drink more than an 8-ounce glass of water a day. Drinking coffee doesn't count. It dehydrates you. Iced tea is caffeinated. It'll dehydrate you. You need to drink water. If you're not a big water drinker like me, you can get those little flavors that you can put in the water that makes it more palatable, and just drink away. If you need to be among those who are sick, wear a mask. If you're going to the doctor for a well visit, you know, it's time for your Medicare visit and you're going during cold and flu season, I'd put a mask in my purse or my pocket. And when you get in there, if you see that there are people that are sick, get that mask on or put it on before you walk in. That's what I would do. If you're running a fever and generally feel unwell, you need to seek medical attention. What we talked about today does not replace getting medical attention as soon as you feel it is necessary or your partner feels it's important for you to get to the doctor and be seen. And of course, if you think about it, please get immunized. That's always a way to help this.